Welcome. Today we're going to deconstruct the sick role. Social construction is a means by which society groups people into different categories. Much like a director casting a play, people are assigned different roles, with some enjoying certain privileges that others are denied. Society applies this framework to different races, genders, and classes to categorize people and define their function by their grouping. Social deconstruction seeks to break down these labels and show them to be non-existent and merely reflective of the society that created them. The sick role concept was first described by an American sociologist named Parsons. He argued that being sick places someone into a role of sanctioned deviance. On a practical level, the person is no longer a productive member of society. Parsons believed that being unwell went beyond the physical symptoms and incurred certain rights and obligations based on society's norms and expectations. These rights dictate that the person is exempt from normal social roles and not responsible for their condition. The sick person is obliged to get better and should seek the help and cooperate with medical treatment and advice. To examine this concept more closely, we're going to look at how the sick role applies to two conditions: breast cancer and opiate addiction. Every year in Ireland, 2,600 women are diagnosed with breast cancer, while 660 die from the disease. It is estimated that there are 11,500 opiate users, with the third highest rate of drug deaths in Ireland. Society defines diseases as legitimate if they have a clear scientific diagnosis, as seen in breast cancer. According to the sick role, the person with the disease is not held responsible for their illness. Those living with addiction can be denied the sick role, as the condition can be seen as a character weakness rather than a legitimate disease. Take, for example, society's views on the stigmata of breast cancer versus addiction. The mastectomy scars are viewed empathetically, while track marks are seen as being the result of deviant behaviour by the people responsible for their own decline. Angelina Jolie's decision to share with society her choice to have a prophylactic double mastectomy has helped decrease the stigmata associated with the procedure, but little coverage was given to her previous struggle with addiction. This can be further seen in the energy that society in general places on awareness and fundraising. The No Makeup Selfie campaign raised €500,000 within 48 hours for the Irish Cancer Society. While this is amazing, does it not further legitimise some diseases at the expense of others? Those with breast cancer have access to specialist units within 2 weeks of referral, while drug users can wait up to 1 year for access to methadone replacement therapy. In summary, Parsons' sick role is limited by the following. It does not allow for those who do not follow its obligations. It gives a limited view of what illness means and how it should be managed. And if an illness does not meet the criteria for the sick role, society views it as a deviance rather than an